Like and subscribe and click the bell icon to get new video updates.
Hopelessly overwhelmed, Sydney hospitals treat patients in corridors. Ambulance trolleys by Lucy Carroll, May 14, 2022, 5.00am. Save login, register or subscribe to save articles for later. Share normal text size, larger text size, very large text size 17. View all comments. Doctors at some of Sydney's biggest hospitals say emergency departments are so overcrowded that patients are being treated in corridors and ambulance trolleys, as the number of ambulances on the city's roads at night has fallen below minimum levels most days this year. One senior emergency specialist warned that bed block, when hospitals are clogged with patients they do not have the beds to admit, was the worst it has been in decades. EDs are under extraordinary pressure, according to the Australian College of Emergency Medicine credit, Jessica Romers. There aren't enough beds in the whole system. Most hospitals have patients backed up in the ED that could go upstairs to a bed if there was one, said the doctor from a key Sydney Metro hospital who wasn't authorised to speak publicly. Paramedics are having to stay with patients, and we are now resorting to seeing people in ambulance trolleys or sitting in a hospital corridor. Australian College of Emergency Medicine President Claire Skinner said EDs were under extraordinary pressure with severe nurse shortages and a wave of people presenting to hospital with influenza, COVID-19, injuries, acute and chronic conditions who have missed or delayed care during the pandemic. Physicians from across NSW tell me these are the worst conditions they have worked in their careers. It's worse now than at the peak of Omicron, Dr. Skinner said, noting ED presentations were up about 30% on pre-pandemic levels at some hospitals. We don't have a system that is geared towards complex or chronic disease. It comes as internal screenshots seen by the Herald reveal the number of ambulances on Sydney's roads at night is frequently falling well below rostered levels. From January to the first week in May this year, there were 86 nights where the number of ambulances available to service the whole Metro Sydney area at night, covering Bondi to Katoomba, dropped below planned levels. The service was down at least 23 ambulances one evening last month. Our supply of resources are hopelessly overwhelmed by demand yet again, a handover email sent by a senior NSW paramedic manager to staff read. There are extensive hospital delays at multiple sites. Patients with COVID-19 are presenting to hospitals, taking up beds and increasing pressure on staff. Credit, Bloomberg. One NSW ambulance manager, who cannot be named because he is not authorised to speak publicly, said paramedics were spending hours waiting outside hospitals including Concord, Prince of Wales, St George and Royal Prince Alfred hospitals. Hospitals are running out of beds for people with COVID or suspected COVID cases. Patients are being put at risk because a lack of paramedics means there are no breaks and staff are often working extended shifts. Another senior emergency doctor at a Western Sydney hospital said wards had reached 110% bed occupancy this week, with about one-third occupied by elderly patients and the emergency department seeing about 220 to 250 patients arriving each day. Nurses are having to get creative at finding spots for patients, the doctor said. The system is surviving on goodwill and staff showing initiative. Hospitals are full of elderly people and people with chronic illness, and we have difficulty discharging them into nursing homes and NDIS. At least 2 patients had waited more than 30 hours in emergency rooms this week before being admitted to wards, the doctor said. There are still a lot of COVID-19 patients which tie up emergency departments. People are going out more, there are more injuries and accidents, and we have hospitals desperately trying to catch up on surgery work, an emergency specialist told the Herald. All these things are adding up to making things about as bad as they've ever been. 30% of people that come to ED need admission, but they can't physically move out of the department if there are no beds to go. That's where the crowding comes in. A spokesperson for NSW Health said that hospitals were experiencing sustained high demand for emergency care and admissions in public hospitals, along with significant staff unavailability due to COVID-19. All local health districts have well-developed workforce surge and demand management plans in place, and our networked hospital system ensures patients can be transferred or redirected to other hospitals, including private hospitals, where necessary. In our emergency departments, our patients are always triaged and seen according to the clinical urgency of their condition, the spokesperson said. A